Hi there, Duncan here, physiotherapist and owner of Life is Movement, here with another exercise video demonstration. I make these videos for my patients here at my clinic. However, if you're not a patient and you find any of this useful, you're of course welcome to take it and use it as you see fit. So I wanted to demonstrate a very entry-level exercise we give to people who have, generally for lower back issues, spasms in the lower back, protruding discs, herniated discs, and so forth. And that is the simple pelvic tilt. A lot of people who do yoga class or Pilates class have some idea how to do this, but I find there's a sort of intricacy to the small movement that is often missed, particularly when people who do it, particularly for people who do it as part of like a group fitness sort of yoga class in your local gym or something like that. So really important to do it correctly for a few reasons. Firstly, as I'll link to another video, but it's really the first step into regaining your spinal flexion, which is basically your ability to sort of bend forward from the spine. So anything like picking something off the floor, or reaching to put on your socks or do your shoelaces, which is often a pattern that is lost or really compromised in people with back issues. It certainly was when I had my back issues. But it's really important to regain that pattern, that flexion pattern, because it's essential for everyday life. And this is the first step in that process, in doing that. And then secondly, some people are aware that for people with disc issues, the intervertebral discs are one of the few parts of the body that don't have a direct blood supply. They only get their sort of hydration and nutrition into them through a funky process called imbibition, which is basically a type of osmosis that requires movement. And when people have back issues, their back often becomes very locked and stops moving. And this can sort of perpetuate things, make things worse, because there's no movement, there's no imbibition, and there's no healing process that takes place, or it's severely compromised. This is why disc issues can often spiral out of control. So pelvic tilt, a tiny exercise, but really, in my experience, quite important. So it's going to be kind of hard to see because it's such a small movement, but I'll try and over-exaggerate it so you can actually see. But basically, we come onto our back, and there's a sort of a lordosis that is somewhat maintained when I lie on my back. And it's sort of, that sort of arch in the lower back. Normally, if you lie on your back, you can sort of feel it. However, all I'm going to do is I often say I push into the floor with my heels, and I think about reducing that arch in the lower back. So all I'm doing is I'm pelvic tilting and coming back. Pelvic tilting and then coming back. It's a really, really simple exercise. However, in my experience, people with back problems can really struggle with it because we often can lose proprioception or a sensation of the injured area. So often when I tell people to pelvic tilt, they just sort of almost look at me confused. A really, really important movement pattern to regain, because it's essential to then be able to flex the spine properly. But we build it from this point because here we are nice and safe lying on the floor. So push the feet into the floor, pelvic tilt, and then back. So quite a complex explanation for a very simple exercise, but here at Life is Movement, we really advocate for never skipping any steps. We build strong foundations that then lead to general health and fitness and optimizing for whatever it is you want to. So start with the pelvic tilt, and then there is a progression from there to regain your spinal flexion pattern. Hope you find that useful.